ever wondered why hypertension, often referred to as the silent killer, is such a big deal? It's a question that deserves our attention. Hypertension, or high blood pressure, is a common condition that affects many people worldwide. Yet, it's often overlooked, underplayed, and underestimated. Hypertension is a bit like a stealthy cat prowling in the shadows. It operates quietly, subtly, and without symptoms, slowly causing damage that may not be noticeable until it's too late. It's a condition that can slip under the radar, making it all the more dangerous. But what makes hypertension so serious? Well, it's a key player in a game we'd all rather not be part of, the game of heart disease and stroke. Over time, hypertension can damage your heart, blood vessels, kidneys, and other parts of your body. This damage can lead to life-threatening complications, like heart attacks and strokes, which are among the leading causes of death globally. Despite its severity, hypertension is often overlooked because it doesn't have obvious symptoms. It's not like a toothache that sends you running to the dentist or a fever that keeps you in bed. This is why it's often discovered during routine medical checkups, or worse, when it causes a severe health crisis. Understanding hypertension is like having a secret weapon against this silent assassin. It empowers us to take control of our health, to prevent or manage the condition, and to minimize the risk of serious complications. It's about knowing what's going on inside our bodies, even when we can't see or feel it. So let's delve into this topic, peel back the layers, and reveal the truth about hypertension. Let's discuss its causes, its silent impact, why knowing your numbers is important, and how we can take steps towards prevention and management. After all, knowledge is power, and when it comes to our health, that power can be life-saving. So isn't it time we shed some light on this silent killer? Hypertension doesn't just happen overnight. It's a result of various factors at play. Let's take a closer look at these causes and how they contribute to the development of this condition. Firstly, we have lifestyle habits. This includes smoking, excessive alcohol consumption, an unhealthy diet, and a lack of physical activity. Each of these habits can raise your blood pressure in unique ways. Smoking, for example, damages the lining of your arteries, leading to a hardening known as atherosclerosis, which can cause hypertension. Excessive alcohol and an unhealthy diet can lead to weight gain and raised cholesterol levels, which puts extra strain on your heart and blood vessels. A lack of physical activity can also lead to weight gain and a decrease in the efficiency of your heart, both of which can raise your blood pressure. Next, we have genetics. Yes, your genes can also play a role in your susceptibility to hypertension. If your parents or close family members have hypertension, you may be more likely to develop it. This is due to both genetic predisposition and shared environment and behaviors. However, it's important to remember that having a family history doesn't guarantee you'll develop hypertension. It simply means you have a higher risk and should be more proactive in managing your health. Last but certainly not least, we have other health conditions. Certain conditions, such as kidney disease, diabetes, and hormone disorders, can all contribute to hypertension. These conditions can affect how your body handles sodium, how your hormones regulate blood pressure, and how your blood vessels function, leading to increased blood pressure. As you can see, hypertension is a multifaceted condition. It's not just about one single cause, but rather a combination of factors that can increase your blood pressure over time. The good news is, understanding these causes can help you take steps to manage your blood pressure and reduce your risk. So, it's clear that hypertension isn't just about high blood pressure, it's a complex condition with multiple causes. Hypertension doesn't just raise your blood pressure, it's a condition that affects your entire body. Let's take a moment to realize how this silent yet potent condition can influence our health. You see, hypertension is not merely about elevated blood pressure readings. It's about the ripple effect it creates within our body, impacting vital organs and systems in ways we may not immediately perceive. Imagine a bustling city where all activities are interconnected. Now think of hypertension as an uninvited guest causing a disruption. This disruption isn't loud or immediate, but gradual and silent, slowly affecting the city's harmony. Our heart, for instance, is like the city's central station. It keeps the life rhythm going, pumping blood ceaselessly. With hypertension, the heart works harder than it should, leading to hypertrophy or enlargement of the heart muscle. Over time, this can lead to heart failure, a condition where the heart can't pump enough blood to meet the body's needs. Then there are our arteries, the highway network of our body. They transport nutrients and oxygen to every cell. Hypertension, however, makes the arteries harder and narrower, a condition known as atherosclerosis. This can lead to heart attacks or strokes as the blood supply to vital organs gets blocked. Our kidneys, the city's waste management system, also bear the brunt of hypertension. They filter out toxins and waste from our bloodstream. But high blood pressure can damage the delicate blood vessels in the kidneys, leading to kidney failure over time. And these are just some examples. Hypertension can affect our eyes, brain, and even sexual health, among other things. It's a silent, pervasive force that can disrupt the smooth functioning of our body's cityscape. Hypertension, therefore, isn't something to brush off lightly. It has far-reaching impacts on our health. So let's give it the attention it deserves, because understanding and managing hypertension can make a world of difference to our overall well-being. With hypertension, ignorance isn't bliss, it's potentially dangerous. This phrase rings true when we talk about the importance of knowing your numbers. You see, blood pressure isn't something that you can feel or see. There are no obvious signs or symptoms that can alert you to high blood pressure. That's why it's often referred to as the silent killer. It doesn't discriminate, it doesn't announce its arrival, and it doesn't knock on your door before it barges in. It silently causes damage to your body, often with catastrophic results. So, how can you fight an enemy that you can't even see? The answer is simple. You have to know your numbers. Regular blood pressure checks are the only way to know if you have hypertension. These checks can be done at a doctor's office, a pharmacy, or even at home with a digital blood pressure monitor. It's a small investment of time that can potentially save your life. Knowing your numbers isn't just about diagnosis, it's also about management. If you've been diagnosed with hypertension, regular checks can help you and your healthcare provider monitor your progress and adjust your treatment as necessary. Blood pressure is measured in millimeters of mercury and is presented as two numbers. The first number, known as systolic pressure, measures the force your heart exerts on the walls of your arteries each time it beats. The second number, known as diastolic pressure, measures the force your heart exerts on the walls of your arteries in between beats. A normal blood pressure reading is generally considered to be around 120/80. If your blood pressure is consistently higher than 130/80, you may have hypertension. It's important to remember that everyone's body is different, and what's considered normal can vary from person to person. That's why it's so crucial to work with your healthcare provider to understand what your numbers mean for you. Remember, knowing your numbers can be your first line of defense against this silent killer. So make it a priority to get regular blood pressure checks. It could be the most important thing you ever do for your health. So, what have we learned about hypertension? In the past few moments, we've dived deep into the world of hypertension, a condition that affects many, yet is often misunderstood. We've unraveled the mystery behind its causes, from genetic factors to lifestyle choices such as a high-salt diet, lack of exercise, and even stress. We've also shed light on why hypertension is known as a silent killer. It can quietly damage your body for years before symptoms develop. Ignoring these symptoms can lead to severe complications, including heart disease and stroke. But it's not all doom and gloom. We've emphasized the importance of knowing your blood pressure numbers. Regular checks and understanding what those numbers mean can be your first line of defense in preventing or managing this condition. In the battle against hypertension, knowledge truly is power. Stay informed, stay healthy.